And for meeting the special needs of self-care ability, for first of all, what we have to do is assessment of self-care ability. Okay, so ongoing patient assessment. Ongoing patient means those who are in hospital. For them, what assessment we have to do means ability of patient to undertake the routine activities of daily living. So there are certain activities of daily livings are there, okay, which is activities of daily living is also known as ADL in short. So which include these activities of daily living includes bathing, grooming, okay, and then eating, maintaining hygiene, all these activities where a normal person can perform in their daily living activities or in their daily life, that is called as activities of daily living. Okay, so what we have to assess is we have to assess the patient's activities of daily living, uh, whether they can able to perform these activities alone or not. We have to see, we have to assess. Okay, first one we have to, under this first one, what we have to assess is bathing or hygiene, whether the patient can able to take bath by themselves, by their own or not, we have to assess. And also to maintain their hygiene or not, we have to assess. Okay, if they cannot able to, they are unable to do unable to perform all these activities, means they are unable to take bath alone, or they are unable to maintain their hygiene, then we have to assist them. Okay, we have to help them, we have to uh, let them do by helping them. Okay, and then next one is, next to bathing we have to see for eating. Okay, some patients they are unable to eat by themselves, okay, by their hand, or patient who are having fracture on their hand or any injury on their hand or any disease condition, any nerve problem. Okay, so those patients, any paralysis patient, those patients they cannot able to eat food with their own hand. So those kind of patients we have to see whether they are able to eat or not by themselves. So if they are unable to eat, then we have to feed them. Okay, or else mm, we have to assist them. Okay, and then next is general assistance. General assistance means getting down from the bed, waking up from the bed, or standing up from sitting position to standing position, and then walking and toileting. All these are general assistance. Okay, so all this also we have to assess whether they can able to move alone or not, they can able to change their position alone or not, and they can able to um, stand up or not, or they can able to walk alone or not. All these we have to check, and if they need any assistance we have to help them. Okay, and then next is grooming. Grooming is also one of the most important daily living activity. Okay, so we have to check, we have to assess whether the patients can able to groom by themselves, means they can able to comb their hair, or they can able to dress up by themselves. Okay, so all those grooming things they can able to do by themselves or not, we have to assess, and if they are unable to do, then we have to assist them. Okay, and we have to do for them either, or we have to assist them. Okay, and then management of own environment. So management of own environment means they can able to keep their things in proper place or not, they can able to fold their this one the clothes or not, or they can able to keep their environment neat and clean or not. So all those abilities, whether they can able to manage their own environment or not, they can when they feel hot, they are putting their fan on by themselves or not. Okay, all those management of maintaining their environment, okay, keeping their environment safe and sound, comfortable or not, that those kind of management also when they can able to do or not, we have to observe, we have to assess. Okay, if they cannot able to do, then we have to teach them, we have to assist them. Okay, and if they can able to do also, we have to observe them while doing so. Okay, and then toileting also, and this is also one of the most important daily living activity. Okay, so some patients who are having problem on their limbs, who are unable to sit by themselves alone. Okay, who have fracture. Okay, all those um, patients who are having problem in sitting position or standing up position, and who are unable to walk alone, all those patients we have to assess whether they are able to do their toileting or not alone. If they cannot able to do, then we have to assist them. Okay, and then assess exact cause of every instance of deficit, that is a problem with vision, then cognitive defects, weakness, if there is any. So what if, so while assessing means we have already discussed so many points. We have to assess grooming, bathing, then general assistance, all those assessment we have done right in previous points. So we have done all those assessment. That's why we will be able to know what are the deficit points, what are the weaknesses, means which are the points they are unable to do, what are the things they are unable to do. So if they are unable to do certain things, then we have to assess the exact cause why they are unable to do this. Because for example, if the person cannot able to eat, and then we have to try to find out what is the main cause, means why the patient is unable to eat. Because whether the patient is having pain on the hand, or whether the patient is having any swallowing difficulty, or what is the exact cause of that particular weakness or particular deficit, we have to try to find out. Okay, so whether the patient is having vision problem or not, any cognitive thinking defect or not, with any weakness or not, that we have to assess. Okay, and then assess patients needs should be assessed, and each patient needs should be assessed for devices that will assist them. These devices can improve the patient's ability to undertake activities of daily living independently. That means we have to assess each and every patient's needs, whether we can give any devices or not. Okay, so for example, for fracture patient, we can give splints, we can give um, we can provide bandage and all. Okay, so those additional devices we can armrest and all we can provide to the fracture patients. Okay, so those devices which we can give to create them or to make them uh, doing activities of daily living independently, activities of daily living activities independently. So these devices will help them in doing all these daily living activities without others assistance. Okay, and then assess the patient's needs for home care upon discharge from hospital. So while before discharge, at the time of discharge also, we have to um, assess the patient's needs. So means at the time of admission, the patient may need some more care, right? Because that time the patient must be having so much problem. But at the time of discharge, the patient might have improved the condition. So the need and the requirement will be little bit different, right? So you have to assess at the time of discharge. You have to assess what are the needs, what are the requirements the patient is having at the time of discharge. Okay, so all those requirements you have to assess, all those needs you have to find out, and then those requirements you have to tell to the caretakers who is going to, or the family members who is going to take care at home for the patient, so that the family members can take care of the patient properly. Okay. And then the patient's personal preference in terms of food, personal hygiene, then products and other similar items should be identified. And also the patient's personal preference. So for each and every patient, their preference for food, their personal hygiene products, everything will be different. Their likes and dislikes will be different, right? So based on their likes and dislikes, we have to provide them, whether it is food or products or anything. While giving care to them, we have to provide based on the patient's preference. Okay. So this is about the meeting patient needs of self-care